How much decongestant for flu is safe? When you're battling the flu and dealing with a stuffy nose, reaching for a decongestant can feel like a quick fix. But how much is safe to take? That's a great question, and it's important to get the facts straight. Decongestants are medicines that help reduce swelling in your nasal passages, making it easier to breathe. They come in pills, liquids, and nasal sprays. The most common oral decongestants are pseudoephedrine and phenylephrine. Remember, these medications only relieving congestion. They don't treat the flu virus itself. For adults, the typical safe dose of pseudoephedrine, which you might find as Sudafed, is 60 milligrams every 4 to 6 hours. You should not take more than 140 milligrams in a day. Some extended release versions allow 120 milligrams twice a day, but the total daily dose still shouldn't go over 240 milligrams. Phenylephrine, often sold as Sudafed Pay, is usually taken as 10 milligrams every 4 hours. Always read and follow the instructions on the product label because formulations can vary. Children's doses depend on their age and weight. Usually, decongestants are not recommended for children under 4 years old. For older kids, the doses are lower than for adults and should be carefully measured according to the instructions or your healthcare provider's advice. Never give decongestants to very young children without medical guidance. Nasal spray decongestants should only be used for 3 to 7 days. Using them longer can cause rebound congestion, where your nose feels worse after stopping the medication. Oral decongestants don't cause rebound but can have other side effects. Speaking of side effects, decongestants can increase your heart rate, raise blood pressure, cause restlessness, or make it hard to sleep. Some people might experience dry mouth or rarely, more serious reactions like hallucinations or allergic responses. If you have high blood pressure, heart disease, thyroid issues, diabetes, or prostate problems, it's best to talk to your doctor before using these medicines. They can advise you on whether decongestants are safe for your specific health situation. Decongestants can also interact with other medicines, especially certain antidepressants and blood pressure drugs, which might cause dangerous increases in blood pressure. Always check with your pharmacist or healthcare provider if you're taking other medications, especially combination cold and flu products that may contain multiple active ingredients. Taking multiple products with the same active ingredient can lead to overdose. While decongestants can help you breathe easier temporarily, they are not a cure for the flu. Rest, staying hydrated, and using fever reducers like acetaminophen or ibuprofen are also key. If your symptoms last more than a week, worsen, or if you experience difficulty breathing, chest pain, or confusion, seek medical help promptly. Remember, decongestants are just one part of managing flu symptoms and should be used responsibly. In summary, the safe amount of decongestant depends on your age, health, and the specific medication. Always follow the dosing instructions, use the lowest effective dose for the shortest time, and consult your healthcare provider if you have any health conditions or questions. Personal medical advice is essential to ensure safe and effective treatment.